Hello everybody, welcome to chapter 37, Common Diseases and Condition. In this chapter, we are discussing about how the disease and different dysfunctional conditions are affecting human body and all the systems of human body, and how people are diagnosed with different diseases. What are the signs and symptoms of those diseases? And so on. Let's begin from the skin disorder. Another name of the skin disorder is integumentary disorder. Let me repeat it once again for you. It's an integumentary disorder. Integumentary system is made up of skin, nails, hair, and sweat and oil glands. As we already discussed in chapter 17, skin is the largest organ in human body. It protects us from the external pathogen, which we call the foreign substances, like bacteria and viruses. But when there is a disorder in the skin layers, we are not protected by those microorganisms which attack us every time. Sometimes it attacks in the skin layer, sometimes in the nail, like nail fungus, sometimes the hair follicle, the little holes in the base of the hair, it is affected. Sometimes the sweat glands and oil glands, which is oily, all the times they are affected. Many skin disorders cause discomfort. There is a change in the natural skin color, and sometimes the color goes hypo and hyper, which is called hypopigmentation and hyperpigmentation. The natural form of the color changes its shape, size, thickness, and so on. The first one is called hives. It's pronounced as hives, also known as urticaria. The word for the hives, another word for the hives is urticaria. It is a relatively common form of allergic reaction. Some allergent, the causative factor of the allergies are called allergent. These allergies are caused by allergent, and because of this allergic reaction, the skin label is raised with red color. Wheals, it's called wheals as well. The smooth layer of skin is raised with red wheals. Wheals may vary in size from a few millimeters to a larger. It depends on what size. It can be caused by the allergies to many things. The common example of allergies are seafood, different seafoods like shellfish, and some drugs. Have you heard any drug causing allergic reaction? Yes, most of the drug, they had the reaction because of the drug reaction, drug to drug reaction. There are so many allergic reactions, and their skin rashes can be seen, and sometimes the reaction of the drug goes with respiratory system, and people have the respiratory disorder. And sometimes those rashes, like some of the antibiotics, they cause a reaction at skin level as well. Another is the most common condition at skin level. It's called dermatitis or contact dermatitis. It is when there is a word TITIS or ITIS at the end. Remember, this is the inflammatory condition. Because of the inflammation, this is called itis. Like inflammation of any part is connected with the prefix itis. Dermatitis is an inflammation of the skin caused by a direct contact with an irritating or allergy causing allergy causing substances. Another single word for that is called allergent. Dermatitis, the skin layer, at the layer of skin, it is when it is continuously mechanically irritating the skin layer because of certain allergens. For example, the cleaning substances, cleaning chemicals, materials, they are allergen. We have to use the gloves while using those. While cleaning the washroom, while cleaning the floors, those cleaning materials are very much allergent. Even the hand sanitizer, they are allergent to some of the skins. That's why some people, they don't want to use the hand sanitizer because it has some irritating substances. Contact dermatitis can be caused by exposure to a material that the client has become allergic to. The contact dermatitis when the person comes into contact with that particular agent. And it is the word itself is a self-explanatory. Contact dermatitis is a skin irritation of the skin, inflammation of the skin because of the person's contact with certain allergen. Irritant dermatitis, there is another dermatitis. Irritant dermatitis can be caused by the reaction to materials such as soaps, detergents, or chemicals usually resemble to burn, like certain acidic or alkalic type of cleaning materials. Even the soaps and detergent, they have those materials, those allergent materials, either by these acidic or the basic. Eczema. Eczema is a redness in the skin condition. It is another inflammation of the skin. Eczema is an inflammatory condition of the skin. It may look different from person to person. So the appearance of eczema could be different. It depends on the person's skin. In the dark skin, it may appear different. In the white skin, it may appear different. The color, the shape, the condition differs from person to person. In most cases, but in general, what happens is, in most cases, it is characterized by the dry, red, and extremely itchy patches on the skin. People keep on scratching the skin layer, and it even makes the eczema worse. In other cases, it can involve papular or vesicular lesions. Vesicular is in the vessel under the layer of the skin. Papular is small pimples. It might cause there. And inside the pimples, the fluid is collected. And if you press hard with that, it might break those little collected fluids, and it is very painful. Shingles, another infection. It's a viral infection. If you see the picture in your textbook, the shingles, it looks horrible. It's very bad skin infection caused by the virus. Shingles is a Viral infection causing a painful rashes of the raised blister. There are blister. Blister are full of these, uh, filled with the pus or certain fluid in the body that can appear anywhere on the body. It is caused by the herpes varicella zoster virus. Remember the name. What viruses cause shingles? Make the statement a question. What viruses can cause shingles? Shingles are caused by herpes varicella zoster virus. Blister outbreak. There is certain blister comes on the skin layer. Lasts about 2 weeks. It lasts about 2 weeks. Remember, the shingles, even if it is healed after the 2 weeks, which is the very usual time period to subside the problem, even the shingles, the pain caused by the shingles remains till 1 year. Even the skin becomes intact. There is no wound or no sign of infection at the skin layer, but the pain is still there for 6 months to 1 year. It can cause extreme and debilitating pain. See here, extreme and debilitating. It's very much uneasy. Debilitating means very uneasy pain. Itching, tingling along the affected nerve, because the main reason of the long period of continuous pain is the involvement of the nerve, in which the pain is very permanent. It doesn't go away easily. When the nerve is involved in any pain, it is very bad pain. Another example I want to give you, which has the nerve involvement. When a person has to cut certain part of the body because of those uncontrolled diabetes, it is called amputation. Because of those amputation, usually below the knees, in the leg, below the knees, it is surgically cut and the person becomes amputee, and it is called, the procedure is called amputation. And because of that procedure, the pain after the surgical activities, the pain remains there forever, because the person has to go through different pain medication, very strong pain medication, but still the pain remains there until the person leaves, because that pain is caused by the nerve pain. Nerve pain means the pain with the involvement of nerve damage. That's why the shingles, these are viral infection caused by the herpes varicella zoster virus, remains for the 2 weeks. It has extreme pain, which is also called the debilitating pain, and itching, tingling along the affected nerve. Scabies. Scabies is not like the viral. It is some mite. It is some pathogen is causing this infection. A highly contagious means it transmits from one person to another person, contagious. It's like SARS, which are more related with those respiratory disorder, but these are the skin disorder, these contagious. When a person with the scabies touches the doorknob without noticing that he can leave his bacteria there, but another person comes and touches the same place and he gets that condition. It's the skin infection caused by a mite. A mite burrows under the skin to deposit its eggs. It's a small creature living under the skin layer, and it produces eggs there, and this causes intense itching. Because of this fertilizing eggs of those mites, it is very much intense itching, and person keeps on scratching the itching area and it becomes inflamed. Scabies is transmitted by skin to skin contact. When we touch somebody, it is transmitted. That's why it is called contagious. Skin to skin means it is highly contagious. Person can transmit this to another person. Between the people, among the people, a person may be contagious for at least a month before the condition is diagnosed. See the seriousness of the disease. A person may be contagious for at least 1 month before the condition is diagnosed, before the person starts to show the sign and symptom of scabies. The person has already become contagious of those infection. Treatment includes a topical application. Topical application means certain cream or certain type of medication that is applied on the skin level. One sad part of the skin disorder is it does not heal that easily. It takes longer and longer period of time to get completely healed. Psoriasis. Pronounce the word in a little bit differently. The pronunciation is called psoriasis. The P, this word remains silent here. It's like in the psychology, which starts from P. It's like in the pneumonia, which starts from P. We don't say pneumonia, we say just the pneumonia, but the spelling begins from the P. As in the pneumonia, as in the psychology, psoriasis also starts with P. Psoriasis is a persistent skin disorder that causes red scaly plaques patches on the skin that can be found anywhere on the body. If the right hand side somebody has a psoriasis, even the left hand also, in the same area of the left hand it comes. It goes together, both parts. If one leg is affected, another leg will also be affected at the same time. These patches are the areas of excessive skin accumulation. Remember, this is autoimmune disorder. When person's immune system is weak, these immune system do not recognize that person already has skin there. But the immune system is producing more and more skin and skin and skin. It is madly producing skin, and that skin becomes flaky skin, scaly flakes, and those flakes of the skin comes out of their psoriasis conditions. They accumulate excessive skin accumulation because the body produces excessive skin in this condition and become inflamed, and those skin become inflamed. Production of unnecessary skin layer, and that skin becomes flaky skin, it becomes inflamed, it becomes very painful, and the cause has not been identified. What is the cause of that psoriasis? Not identified, but there are certain conditions that make psoriasis worse. Lack of sleep, excessive stress level, drinking alcohol, and smoking is one of the worst condition that makes psoriasis even worse. So we have to know about it. Boil. Boil is another skin disorder. A boil or furuncles is a skin disorder caused by the infection of the hair follicle. Your hair follicle, the base of your hair, usually by the bacteria called Staphylococcus. Let's pronounce the word together. Staphylococcus bacteria. It's a bacterial infection. We already discussed about there are many type of infection. The most common type is bacterial infection, For that, antibiotic is given. Another is viral infection, which has 2 weeks period to subside the sign and symptom. Sometimes, but not for sure. Sometimes people die because of the viral infection, which does not go away after even by 2 weeks. And another is fungal infection, like the toenails. People have the toenails problem, fungal infection. There are so many parts in the body which is sometimes infection in the head. It's called meningitis, meningia, the layer of the 3 layers of the head. There is a fluid in between the layers which is called cerebrospinal fluid. That fluid becomes inflamed, infected, and people have head infection, meningitis. Sometimes people have the appendix, that is the inflammation of the appendix, and it goes appendicitis. There are so many. Inflammation of the kidney, nephritis, inflammation of the bladder, urinary bladder, cystitis. There are so many infections. And usually the bacterial infection and viral infection are most common, along with the fungal infection. Boils present as a red pus filled. Pus means when people have the wound, that wound gives like a double coffee color um, um, fluid coming there. It's full of the bacteria and the dead tissue of the muscles and skin tissue and the muscle tissue. That's called pus. Pus-filled lumps that are painful. The most common site for the boils are the back, underarms, shoulders, thighs, and buttocks. It's called the buttock cheek, which are most common site of these boils. Cannot predict when the boil may break, so you always use standard practice when providing care. Means, as a personal support worker, if we are working with the client having those boils, it can break at any time. It will unpredictable. That's why we have to follow the standard practices, standard PPE, personal protective equipment, PPE, which are using the gloves, sometimes using the gown, and sometimes even we have to use the mask because the pus might burst from the boil and come to our face. We have to protect our face. Similarly, the cyst, under the skin layer, certain thing happens. An abnormal closed sac, it's not open, it's closed. Skin is closed, but it's inside the skin. That can occur anywhere in the body. The sac may contain air. It's not like the previous boil or psoriasis or scabies or shingles. It is a little bit different because it can, the cyst, the pimples inside may have contain air, fluid, or semi-solid material and has a distinct membrane enclosing it. A certain kind of another muscle tissue or the thickest part of another skin layer, it encloses it and it is not open. It is inside the skin layer. Once this cyst has been formed, it will remain in the tissue unless it is removed surgically or by the medication. That's why this is not the inflammation, but it is a formation of the new tissue. It's called cyst. When it is formed, it needs to be removed either by the surgical procedure or by the medication. Impetigo. Another skin condition, impetigo. Let's go with the impetigo. A contagious skin disorder. It's a bacterial infection. A contagious skin disorder that is caused either by Streptococcus or Staphylococcus bacteria. These are two most common bacteria we get in our lifetime. These two bacteria are treated by the antibiotics. Streptococcus or Staphylococcus bacteria. A cut or a scratch can become infected when unknowingly when we cut certain part of our hand or finger, it becomes infected way before we know it, it is already infected, and the bacteria are spread by the client scratching the area. This is most contagious. Your hand has a cut and it has the bacterial infection of Streptococcus or Staphylococcus bacteria. You scratch that area with another hand. After some time, your another hand is also infected. You touch the hand at your neck. Again, your neck is infected. You touch the hand with the doorknob. Somebody touches the doorknob. That person gets the infection. That's why it is contagious. It is transmitted from one person to another person. Even the same person's different parts of the body, it will cover, it will spread like the cancer. It will spread whole part of the body. That's why we have to maintain hand washing, hand sanitizing. This is the best way to prevent those bacterial infection. Infected area forms a crust that can drain and spread the bacteria. Remember, the crust, like the bread crust, it makes the skin layer a little bit hard to touch, and that can drain and spread. That collects, that drain, that spreads and spreads the bacteria. That's the source of this infection. Use standard practices when caring for the client with Impetigo. We have to follow the proper PPE procedure, like wearing the gowns and gloves and caring the person with those disease conditions. Let's go with the skin tag. Skin tag is just the development of a little bit extra skin. A small flap of flesh-colored skin that looks like a droplet or tag of skin. It's not painful. The most common on women and older adults. Generally, people with a heavy body weight, body mass index, which we call obesity, these people have so many skin tags. People with diabetic, they have these skin tags. And you will see, if you see those skin tags, you will understand this skin tag is a flesh-colored skin that looks like the droplet or tag, and which is not painful. And it is cleared by the surgical procedure, which is a minor surgery. Athlete's foot, a highly contagious fungal infection. As we already discussed, fungal infection is caused by the fungi, and those fungus from the food, from other sources, that causes the affected foot to peel, burn, itch, and turn red. Fungal infection goes generally in the foot, and it makes the foot to peel, peeling the skin layer, and it makes burning sensation. It's very painful, it's itchy, and red, it turns red. Easily spread through the contact. It's a contact. It is contagious. We already discussed it is very contagious. And when you touch that area with other parts of the body, it will go to that side. And it is treated over-the-counter medications. It is called OTC. It's not TTC, it's OTC, means over-the-counter medication. Don't get confused. When you write OTC, you will remember TTC, which is totally different, right? Over-the-counter medication are those kind of medication which do not need doctor's prescription. You just go to the pharmacy and tell the pharmacist that you want that medication. That's called OTC medication. Skin cancer. That's the most horrible condition of the skin disorder. A malignant, there are two types of development of the skin layers in the body, malignant and benign. A malignant is cancerous, and benign is non-cancerous. A malignant growth on the skin that usually develops in the epidermis, the outer layer, and is and so is easily visible. We can see the different changes in the skin color and skin turgor. The flexibility of the skin is called skin turgor. The two most common type of skin cancer are basal cell carcinoma. The cancer, another name for the cancer in the scientific name is carcinoma, and squamous cell carcinoma. Again, this is a cancer. Both carcinoma means cancer. Basal cell carcinoma and squamous cell carcinoma. Let's discuss what are these. Skin cancer. The most dangerous type of skin cancer is malignant melanoma. See, another. The most dangerous. Malignant melanoma, which can be fatal if not treated early. You can go to page number 849 that depicts the photos of the various skin cancer. You can see those photos. Because of those photos, it gives you as a visual aid of learning. And if you see those photos, you will understand the name of the skin cancer attached with the photos. That will help you to understand for your understanding. Now we are going to another number 2 system of our body, which is called musculo-bones skeletal disorder. The disorder of the muscle and bone. It affects the ability to move about. Muscle and skeletal bones, they are joined together by the cartilage and ligament. They allow us the movement. When there is a disorder in that level, it definitely affects the ability to move. Our movement is affected, which we also call the gait, G-A-I-T, gait. Our gait, the balance. We cannot make a balance when we have a musculoskeletal disorder. Means when we don't have the balance, we cannot maintain the balance, definitely we fall, and it impairs our movement. It affects the bones, joints, and the muscle. Musculoskeletal disorder basically joints, bones. It affects the bones, joints, and muscle. Have you heard the name arthritis, the joint pain of the joints? It goes under the musculoskeletal. A result of the injury and aging. So because of the injury, generally what is the most common injury of the people? It's a motor vehicle injury and the injury related with the falls. People fall, elderly people fall from the bed, fall from the stair. Sometimes they fall from the floor to like 8th floor to the ground and they die. So result of the injury, motor vehicle injury is the most common injury we see in the nursing field. And because of the developmental process of life, which we call aging, because of the aging process, muscle becomes weak, ligament becomes weak, we lose the muscle tone, we lose the bone masses, like those osteoporosis type of disease because of the loss of bone density in the body, and we have a joint problem. It can affect the people at any age. However, the elderly population are always the first target of this musculoskeletal disorder, means the disorder of muscle and bones. Now the fractures. There are different types of fractures. A broken bone. A fracture is called the broken bone. A tissue around the fracture are usually injured. When the fracture happens, the muscle, the blood vessels around there, the nerves and the tendons, all these parts of the musculoskeletal system, they are badly affected by the injury. Generally, what is the most common fracture area? Fracture of the skull, the head injury. Fracture of the hip fracture, most common in older population. Because of the fracture of the hip, there is a replacement of the hip, which is called total hip replacement. And fracture of the knees, the fracture of the elbows, these are the most common fracture areas. The types, there are two types of fracture. One is called closed or simple fracture, another is open and compound fracture. make the statement into question. How many types of fracture are there? There are two types of fracture, broadly categorizing the fracture into two types. One is closed, one is open. Closed fracture is also called the simple fractures, and open fracture is a compound fracture. You can see the visibly wound is there in that fractures. And in fractures, what are the things involved? It's a broken bone and muscle, blood vessel, nerves, and tendons. All these parts connected with the bones are affected badly. The causes of the fractures. We have to know what are the causes of fracture. As a personal support worker, we have to protect our clients from the falls. Fall is a number one cause of fracture. When people fall from the bed, they will have a fracture. When they have a fracture, they will have to go to hospital. In the hospital, they get another disease, another infection. That's why the best idea is we have to protect our clients from the falls. Accident, as we discussed, motor vehicle accidents. Cancer, another form of disease. Alcoholism, people drink a lot of alcohol and they fall from so many places, they have a fracture. Osteoporosis, as I discussed already, the osteoporosis is the bone disease. When people have less and less bone, they will have the brittle bone, less bone. Bone density will decrease a lot in the body, and people have a very, very fragile bone. Once they fall from the chair, they will break everything there. That's why we have to protect people from the fall. Again, the osteoporosis, this is a bone disease. It is most common bone disease, especially in the older people after 50 or 60 years of age. Sign and symptom of fractures. Let's see, what are the sign and symptom of fracture? In the exam, this might be the question for you. Your final exam I'm talking about, your licensing exam. Your client has a fracture. How you know the client has a fracture? The client does not walk properly. Which of the following is a sign of fracture? You can notice there are so many scenarios will be provided, and you have to understand that. That's why when we read this chapter for the first time, let's focus on those discussion, and let's read those chapters with your textbook together so that you will understand very nicely. So the sign and symptom of the fracture: limb looks bent or out of position. Limb means your legs. Bent, out of position. You cannot, the person with the fracture cannot put the legs as we can put. It's out of position. There is a pain, the person complaining of the pain. Swelling, it is bigger in size. Limited movement, definitely there is an injury, that's why the movement is limited. Loss of function, the person cannot move the leg properly as we do. Bruising, there is a bruise there at the skin level. The red color, when there is a bruise, the color is red because the blood is collected there in bruise. Color changes in the skin. Sometimes the skin changes into blue color. It's called cyanotic. It's because of the lack of proper circulation. The color of the skin changes. If there is a bruising, it's a red in color. If there is a no good blood circulation, it becomes bluish color, blue color, which is called cyanosis. And the cyanosis, bluish color, happens when there is a lack of blood circulation because of the injuries at the fracture site. And sometimes there is an internal and external bleeding because of, if the internal organ, if the because of this fracture, if the kidney is damaged, it gives internal bleeding. When people go for pee, they will pee the red color, and people will scare because it's not the normal pee, it's not the normal voiding. That's why the kidney damage, the bladder damage, the internal blood vessels are damaged. It is indicated by those things. So bleeding can be internal, can be external. Fracture healing, how to make those fracture okay. Healing is making them okay. Bone ends are brought into the normal position. Bone ends, when the bones are deviated from the normal position, it is brought back to the normal position by pulling them the both end together, and there is a cast is put there. Reduction is a closed reduction, skin is not open. There are two type of reduction. Normal position means reduction. In the closed normal position, closed reduction, skin is not opened. In open reduction, because of the surgery is done there, and nails are put there like in the wood or logs. Rods are also put, pins, screw plates, wires are also used for the open reduction of the wound. Cast is applied because of certain bandages like the plaster. It is applied. Sometime it is plastered, and sometime it is put with iron piece of the rod, even the outside, and it is tied properly to maintain the normal position. It is done like that. Cast is, this is how the cast is applied. And when we have to work with the client having the cast, we have to be careful. It is called cast care. The person having the cast after certain surgical procedure. The cast is made of the plaster, as we already said. Cast is made of the plaster, sometimes fiber glasses or the plastic. Plaster dries in 24 to 48 hours. We cannot put water in the cast. Odorless, white, shiny when dry. The cast must be odorless. If there is an odor, there is an infection. It should be white and very shiny, glossy when it is dried. As a support worker, you may assist the client with the cast care. Please, I request you to go to page number 852, see the guidelines of cast care. I can explain those guidelines here. Like when providing the cast care, you have to make a movement, zero movement of the cast. You cannot move the cast. You have to ask the person if the person is having the pain. If there is an odor, that foul smelling of the cast may indicate there is an infection, the pus filled inside the wound. If it is not white, you may have put some water or other solution. Do not put anything there. Even do not clean the cast from outside. Do not put any plastic in outside the cast. It has to be shiny and dry. If you see if the person is complaining of the pain, complaining of the tight, you can see after beside the cast area, if it is very red, it is inflammation. If it is bluish in color, it is the sign of lack of blood circulation. We have to report. A personal support worker is a big reporter. We are there to report. Because any other condition, we are not there to give the medication. We are there to observe the thing while providing care. We are there, we see the situation, we report to the nurse, and we report to the supervisor, and we advocate our client for their betterment. We already discussed about the hip fracture. Hip fracture is the most common fracture in elderly population nowadays. Hip fracture hips are common in older adult client. Older women are very higher risk than older men. The two sign and fracture are shortening of the leg. The legs become shortened. What is the sign and symptom of the fracture? Hip fracture, the hip are shortening and it is facing outward, not inward. The leg is facing the hip, the whole hip, from hip to the feet, it is facing outward, rotation of the leg. Healing is slower. Why this healing is slower in elderly population? Because their taste bud is very dysfunctional. They don't eat much, and for the healing, they have to eat a lot of protein. In the older adult, they don't eat. That's why the diet for the hip fracture people are once again planned by the dietitians. Another post-operative problem present in the life-threatening risks. When people go for the operation of the hip replacement, It is called hip fracture. When there is a hip fracture, the hip is replaced by the surgeons. And after the surgery, the person has a greater risk of developing life-threatening condition. And number one culprit is the pneumonia. See the spelling of pneumonia? P is silent. We don't care this P. While pronouncing, we say pneumonia. But the spelling is P pneumonia. Don't say the P pneumonia. And urinary tract infection. Because of the lack of movement, the urinary tract infection is another risk factor for the elderly population, because women's urethra is very short and they are always prone to get UTIs, urinary tract infection, and after the surgery, they are very risk of getting those infection. Thrombi means blood clot. Have you seen the clotted blood? This is a thick, like a solid type of blood. It's a semi-solid blood. Generally, the blood in the menstruation, people have the certain pieces of the big pieces of the blood comes, that is the blood clots. In the leg veins, what happens when you do not move your leg for a long time? There is a pool of blood inside the vein. It does not circulate. That's why you have to do certain massage to the legs. We have to do movement of the leg. Generally, when people travel by the plane, like 18 hours travel in the plane, you have to take certain medication to make the blood thin, because the veins in the leg, sometimes the blood becomes clot. And if the little piece of the clotted blood mix with the circulatory blood, it blocks the small arteries and it causes a stroke in the head. That's why we have to do certain leg movement. We have to walk a little bit every time. Every like 2-3 hours later, we have to stretch the legs and do. Even if you sit in the chair for a long period of time, this can happen. So basically, our client after the surgery, they are in the bed for a long period of time. Therefore, we have to do certain massage, certain leg exercise when they come from the surgery. It means pressure ulcer. When people sleep in the bed for a long period of time, because of the skin layer has a contact with the bed and a continuous pressure from the skin with the bed mattresses, it gives the skin layer problem. It's the beginning of the ulcer, which is called pressure ulcer. And constipation. They don't drink a lot of fluid because of the bedridden condition, because of the pain medication causing constipation. Lack of proper fluid taking causes constipation. They do not make a good movement in the body. That's why they have constipation. Constipation is a very common condition after the surgical procedure. And confusion are other risks. People are confused. What are the confusing factor? What makes a person confused? Because of the change in the places, because of medication, because of pain. See, all these are the causes of confusion. So we have to see the client's condition and we have to report to the nurse or the nursing supervisor. If fracture continued, the fracture hip is fixed in the position with the pin, nail, plate, screw, and artificial hip joint. It is the still hip is put there. Some hip fracture require partial or total hip replacement. It's called THR, total hip replacement, or sometimes the partial hip replacement. The pre-operative means before the surgery, pre-operative before the operation. Pre-operative and post-operative care means after the operation. Post means after, pre means before. Pre-operative and post-operative care, the nurses will be there to teach the client before the surgery and after the, even before the surgery, she teaches or he teaches the client what to do before the surgery and what to do after the surgery. Please go to box 37.2 and read Caring for the Client with the Hip Fractures. It is in the page number 853. It's given there. So I can discuss that here, like the client with the surgery. There is the first important point is after the surgery, when people come to home or long-term care or in the hospital setting, we have to give them uh, the the deep breathing practice. Because of the deep breathing, the pneumonia can be prevented. And because of the ambulation, it's the walking, little bit walking. Because of the ambulation, the blood clot formation can be prevented. That's why the post-operative client needs to follow certain schedule of exercise as well. Osteomyelitis. See, litis, again the inflammation of the bone marrow. This is inside the bone, there is a bone marrow where the red blood cell is formed. Where is the red blood cell formed? It's in the bone marrow. And the inflammation of that bone marrow is called osteomyelitis. Remember, this terminology looks horrible in the beginning, but later on you will understand, because practice makes everybody perfect. You need to practice this. Inflammation or infection of the bone marrow often caused by the Staphylococcus bacteria. It is bacterial infection. It can be complication of the fracture. When people have a fracture, this infection might enter the body. And orthopedic surgery. It is the surgery of the bone. Orthopedic. Remember the word ortho means bone, orthopedic surgery, bone surgery. If not known early, if those osteomyelitis not known, myelitis not known early, it can lead to pain, loss of the function of the body parts, loss of the function. Constant drainage means the wound does not heal and there is a drainage of the fluid, different type of fluid comes, and even death, person even dies because of these conditions. Report acute localized pain. If the person says, I have severe pain, localized pain means the pain in the local area. Redness, there is another sign of infection, redness. Drainage, if there is something fluid coming out of the wound. Fever means increased temperature. And malaise, tiredness. These are called the cardinal sign of infection. These are called cardinal sign of infection. Localized pain, redness, drainage, increased temperature means fever, and malaise is a tiredness. If the person complains of all these signs and symptoms, we have to report to the nurse. This is our prime duty. This is the safety for the client. This is how we can protect the client's life. Amputation of the limb. We already discussed about amputation, just cutting the leg below the knee or something like that. Amputation of the limb, loss of limb. And amputation is the removal of all or part of the extremity. What do you mean by extremity? The hands or the legs, extremity. Basically, think it's the removal of the leg. Traumatic amputation occurs by accident. Because of the motor vehicle accident, people's legs are totally out of use. They are not any beneficial for the person. Person cannot heal with those injury. That's why the team of the doctor decide to cut and throw that. That's called amputation. It's a surgical amputation is performed when the limb is severely damaged, very badly damaged. The doctors cannot treat them, and the damaged limb cannot be brought back to the normal functioning level. When it is dysfunctional, when it is no use, then it has to be removed. Then the part of the limb has to be removed. Most common cause of amputation is diabetes. As I already talked to you, the amputation because of the uncontrolled diabetes, person's leg doesn't get any oxygen, and the person's leg, the tissue dies there. When the tissue dies, you cannot revive the tissues. You cannot bring those tissue back to the normal tissues. That's why amputation is mandatory at that situation. Gangrene is the dead tissue inside the body. It's a condition in which there is a death of tissue. Tissue dies in the body. It causes include infection. Because of the infection, tissue dies. Because of the frostbite, if you go to the snow without wearing proper gloves and gowns and shoes, might be the frost will bite. And because of the burn, you can see the picture of burns in the textbook. See, it's very horrible picture because of the injuries and circulatory disorder. When people don't have a good circulatory disorder, their arteries and veins in the body are not functioning in a proper order because of the high cholesterol and other diseases, other condition. They have a circulatory disorder, and all these conditions, maybe one of or two of them altogether, they cause gangrene. And gangrene means death of tissue, and it has to be removed by the surgical procedure. It's a minor surgery. Surgery is needed to remove the dead tissue. See, surgery is needed to remove the dead tissue. If untreated, gangrene spreads throughout the body. The dead tissue makes the surrounding tissue also dead. See, a rotten potato, one rotten potato in a big sack can make other potatoes also like that. It's like that. A gangrene, the dead tissue, a little bit piece of a dead tissue can make the living tissue very bad, dead. The gangrene can cause death. If the gangrene is not treated well, it can cause death. Now, prosthesis. Prosthesis is the artificial, the part of the body when people have some amputation. It is an artificial replacement of the missing body part. That's terrible. Prosthesis. When somebody has cut the leg, they are given artificial leg. Occupational therapists are the main professional working in those prostheses, and physiotherapists. Occupational therapist and physiotherapist. The name of these guys, occupational therapist, is OT. It's called OT, occupational therapist, and PT, physiotherapist. They help the client to use the prosthesis. How to use that, how to use the artificial leg when their leg is cut. They help them. The client may feel that amputated limb is still there. The client was unconscious. I give you one scenario. The client has a motor vehicle accident, or the client has the untreated, uncontrolled diabetic high blood sugar for a long period of time. The client's body part was totally out of function. The client was unconscious. The client was taken to the hospital. The team of the doctor decided to do the amputation. When the client was fainted, he was unconscious, he didn't know he was in the hospital. But when he wake up in the hospital bed, he feels that his leg is still, or her leg is still there, but it's not there. See what type of pain, what type of loss of the body part they will feel. We can imagine. The client, that's why the client still may feel that the amputated limb is still there, but it's not there. The client may complain of the pain in the amputated part because so many things are cut. When the leg is cut, its nerve is cut, the muscle is cut, the bone is cut, the vein is cut, the artery is cut, everything cut. When because of that cut, there is a continuous severe pain, it is called phantom pain. This phantom pain is basically the pain caused by the nerve damage. We already discussed about that phantom pain and the nerve damage. It is called phantom pain. This pain remains in that side until the person survives. Phantom pain. A pain in the limb that has been amputated, sometimes hard to control. See, this phantom pain is very hard to control. Can sometimes involve the major psychological adjustment. When people have all the time 24/7 the pain condition, it is very disturbing for the person's psychology. The dominant theory for the cause of this pain is the irritation to the nerve ending in the stump. When people have a wound, that stump is wound, the cutting, the place where it is cut and put something there is stump. and they have a pain. Because of that phantom pain after the amputation, person has to go to the psychiatrist sometime, because the psychologically person is disturbed and the person needs the major psychological adjustment, and psychiatrist is the main person to work with this situation. Let's go to prosthesis. Prosthesis, when we are working with the client having prosthesis, we have to do very nice and careful. We have to be careful. Skin care is most important after the person has a prosthesis. Often skin is not exposed to the air in the prosthesis, may become hot and moist, causing irritation. Blister, there is a blister, the full of this fluid inside that blister pocket patches, and skin infection. These are the condition risk factor of the prosthesis. It may become hot and moist. It might cause the irritation to the client. It may be there may be blisters in the skin layer, and the skin become infectious. There is an infection in the skin. Notify your supervisor immediately. Means talk to your nurse. Your client is having some changes in the condition. Whenever there is a changes in the condition, our duty is to notify the supervisor immediately, as soon as possible. If the client complains of pain at the prosthesis site, when the client has a pain in this site, the area of the treatment, the surgical procedure, where the person is wearing the prosthesis, we have to notify the nurse immediately. Report any changes, any redness, any swelling, any drainage, any fluid coming from that wound. You can report that drainage and any other things coming there to the side. Now we are coming another bone disease. We are discussing about which system. I asked you one question. Which system we are discussing? We're discussing about musculo-skeletal, muscle disease and bone disease. Osteoporosis, a bone disorder in which the bone becomes porous. Porous means full of the little holes, and brittle means very thin. Bone become easily. Bones break easily. Spine, hips, wrist most affected. What are the most affected area of this disease, osteoporosis? Because of the brittle and porous bone, weak bone, fragile bone, thin bone, spine, hips, wrist are mostly affected in the older adult. In common older adults and older women after the menopause, there are the risk factor of the osteoporosis. What are the risk factor of osteoporosis? Just make the question of this statement. Lack of estrogen and calcium. When women after the menopause, they don't produce much of this hormone. It's a female hormone, estrogen, and because of the smoking is another cause of osteoporosis. High level of alcohol consumption is another cause of osteoporosis. Lack of physical exercise. You know what? There is an exercise called weight-bearing exercise to prevent osteoporosis. You have to do weight bearing. You have to carry certain weight and do that exercise. You have to press hard to your body for this exercise to prevent. And sometimes when people are long time in the bed rest, they may be having those osteoporosis, because bed rest means immobility. Immobility means no exercise. No exercise means osteoporosis. Lack of calcium, oxygen, and smoking are other cofactors. Let's go to another, arthritis. This is an inflammation of the joints. Arthritis means inflammation of the joints. The most common joint disease. Arthritis means inflammation of the joints. Remember, this is very common. Everybody knows it. Swelling, redness, heat, and pain. The most two common type of arthritis are osteoarthritis and rheumatoid arthritis. What is another name? Rheumatoid arthritis. Two type of arthritis. It's a joint disease. Osteoarthritis, the short form is OA. It occurs with aging, joint injury, and obesity. We already talked about obesity, joint injury. this arthritis occurs. About 80% Canadians are affected by the age at the age of 75. 80% Canadians will have arthritis at the age of 75 years of age. Affects weight-bearing joints. I just told you before that. Joint-bearing exercise such as hips, knees, ankles, and spine. These are the major area of those affecting area. Cartilage gradually breaks down and swears out. When the cartilage, the joining part of the muscle, it breaks down, it does not regenerate. Once broken, it's done. Eventually, bones may rub together. There is a rattling sound of the bone. I have worked with those clients with the osteoarthritis. When they are moving their finger, there is a bone inside the finger in the hand. It is rattling. There is a rattling sound of the bones because they rub together. Cartilage does not regrow. I told you, it's not regenerable. It does not regrow. Once damaged, it is damaged forever. And pain is the number one condition after people having those osteoarthritis. Pain is often less severe in the morning. Remember, I want you to remember this. Pain is less severe in the morning. In osteoarthritis, pain is less severe in the morning. In rheumatoid arthritis, pain is more in the morning. It will be in your examination. I guarantee this is the question for your exam. In osteoarthritis, pain is less severe in the morning. And when is pain very bad? During the afternoon in osteoarthritis. In rheumatoid arthritis, let's wait. It worsens during the day. It occurs with the weight bearing and joint movement. When people have the weight bearing type of exercise and a little bit joint movement, the pain occurs. Severe pain cause interfere with the rest and sleep. People can't go to bed and sleep because of the pain. They need pain medication. If you see the person's face having pain or complaining of the pain, report to the nurse. As a support worker, we are working in between the client and the nurse, and we are reporting them. We are just the reporter. Cold weather and the dampness seems to increase the symptom. See the Canadian cold weather for the longer winters, and older people have those osteoarthritis, very, very worsening condition. Bony growths can thicken and form growths called spurs. There is a growth of the bony prominence of the body, and that bone is not necessary. Unnecessary thickness of the bone makes it more painful. This is all about the osteoarthritis. Now let's go to rheumatoid arthritis. Okay, let's go for the treatment. Osteoarthritis has no cure. See, it has no cure. Only the medication is given for the symptom management and pain management. Treatment involves relieving pain and stiffness. Good body alignment means body posture. Alignment means the posture. Anti-inflammatory drugs. Pain medication, often Tylenol, are given as a main medication for this osteoarthritis. Local heat or cold application. Heat and cold application is applied. It's non-pharmacological, non-medicinal. Weight loss for the obese person. Doctor recommends to lose the weight for the obese person. Higher body mass index, excessive body mass. Cane, walker, and range of motion, ROM, room. Range of motion means when the person is in the bed, we have to do some exercise, which is called range of motion exercise. We can do measures to prevent the fall. Always we have to protect the client from the fall because the fall makes their pain even worse. Assistance with the daily activities as needed. So actually, what are we doing here? Can anybody tell me? We are just discussing here what is the role of the PSW when we work with the client diagnosed with osteoarthritis. These are the basic day-to-day activities we have to follow, and we have to communicate, and we have to see, and we have to assist the client. Assist with daily activities as needed. We have to help them in the feeding, in transferring while wearing the uniform dress, while transferring them from bed to the wheelchair, wheelchair to the bed, taking in the wheelchair them to the dining area, assisting them as per needed. It says here as needed. Don't do 100% work of there. Encourage them. It means you are making them independent. Elevate toilet seats helpful for the client with the limited range of motion in the hips and knees. People with these osteoarthritis and the surgical procedure, the toilet seat is more elevated. It makes more higher so that they don't have to worry about that. Now we go to the rheumatoid arthritis. As I told you, in the osteoarthritis, pain is severe in the morning, usually a chronic disease, usually affects the people between the ages of 25 to 50. See, this is a very terrible, but it can affect all ages from the toddlers to the older adults. Affects 1 in 100 Canadians. It's a very bad disease. More common in women. Women are very common in getting this. Rheumatoid affected areas by RA, rheumatoid arthritis, connective tissue throughout the body will be affected by that. That's why body movement and joint movement are affected. Small joints like in the fingers, hands, and feet are affected first. Also affects the heart, lungs, eyes, kidneys, and skin. It can affect all the way. Severe inflammation causes very painful and swollen joint. The joints are swollen. It becomes very, very painful and thick. As disease progresses, more joints become involved. All the joints parts of the body become involved. Rest is important. Rest is very important. Pain and stiffness are worse in the morning. See here, pain and stiffness are worst in the morning. In another arthritis, osteoarthritis, pain is not severe in the morning. Here, pain are worst in the morning and gradually decrease during the day. Exercise is important. Range of motion exercise, not the physical exercise type of workout type of exercise. Scar tissue in the joint will cause deformities. There are certain tissue develop, scar tissue, not which are after the injury, another tissue develops in the body which is scar tissue. That scar tissue does not have a regular function. That will cause deformities. Gout. Gout is metabolic disorder. It is one brand of arthritis. It is also called metabolic arthritis. When people have a kidney disorder, they have this type of arthritis. It is caused by the accumulation of the uric acid in the cartilage. When the kidney has to excrete uric acid in urine, but it is not filtering those uric acid in the urine. That's why it is collected, it is collected in the cartilage of the joint, especially the tendons. It usually affects the big toe first. See, always see the big toe. If the healthy big toe means the person is healthy. Sign include severe and sudden pain, swelling, redness, warmth, stiffness, joint, and low-grade fever. Person has a fever all the time, but it's not very high. It's a low-grade fever. Treat with the pain medication. Always, these are not curable. Only the pain medication. Sometimes cold packs, like ice pack. Sometimes hot water, like hot warm massage is given. Sometimes they are given anti-inflammatory drugs to prevent the inflammation. Similarly, fibromyalgia. See, another name of the disorder is called fibromyalgia. This is a stiffness of the muscle. Condition associated with the aching means painful, aching, stiffness, fatigue means tiredness of muscle, ligaments, and tendons. These are the joining muscle and bone and muscle. What, what tissue joins bone and muscle? It's the ligament and tendons. Fibromyalgia, it can affect many areas from neck to the feet. Fatigue means tiredness and the sleep disturbance because of the pain. Sleep disturbance make even the simple tasks difficult. People cannot bend, people have the muscle issue, but people's muscle is full of pain, it is stiff, it is not movable. That's why the general tasks, the activities of daily livings are impaired, becomes totally or partially dysfunctional. The worst side, the thing is, it has no cure. Only the medication is given for the symptom management. Sometimes heat, cold, massage can help. It causes circulation, increased circulation. Stretching also helps. Range of motion exercise. Person is sleeping in the bed, we are doing their hand and leg exercise. It helps for the fibromyalgia. Now we are coming to another system called nervous system disorder. In the previous class, chapter 17, we discussed about the nervous system a lot there, and now we are discussing the disorder of nervous system. Nervous system disorder can affect the cognitive, means mental, and physical function is the bodily function. Because our body is always controlled by the cognitive, by the mind, by the central nervous system, the central nervous system, the brain and the spinal cord. Physical function, how it disturbs the physical function, let's begin from here. It includes the tasks such as moving, touching, seeing, hearing, controlling blood, bowel means using toilet, bowel and bladder. This is for the urination, this is for bowel movement, bladder and bowel. All these things are controlled by the central nervous system and peripheral nervous system, and it is dysfunctional. And the cognitive function means all about the mental and the language type of function, include the control by the mind, such as thinking. See, cognitive function. What are the cognitive function we are discussing here? Cognitive function, thinking, reasoning, understanding something, remembering, learning, reading, and problem solving, making some judgment. All these cognitive functions are also impaired when the nervous system disorder takes place. Epilepsy. See, epilepsy. It's very unpleasant experience when people have epilepsy. Recurrent episode of convulsive seizure. In epilepsy, there are certain electrical overburst of the electrical impulses in the brain. That's called convulsive seizures. Sensory disturbance and abnormal behaviors and loss of the consciousness. This is seizure. A seizure involves violent and sudden contraction and tremors of the muscle. Tremors means the shaking. Contraction means opposite of relax, contract, being so much, the stiff. Contraction and tremors of the muscle group and the caused by the uncontrolled movement and loss of the consciousness. People become unconscious. Epilepsy. It's called seizure. Epilepsy, another name for the seizure. Seizure. People just fall on the floor and it starts shaking the body. Sometimes they die by chewing their tongue. That's why we have to be very careful while working with the clients who are diagnosed with epilepsies. A single seizure does not mean the person has epilepsy. Sometimes when people have a fever, like children, When they have a fever, they fall, they're in the floor or in the bed, they start shaking the body, and we take them to the hospital. That's called seizure. But a single seizure does not mean the person has epilepsy, but it can develop at any time. A single seizure can uh, put the person in a higher risk of developing epilepsy. Epilepsy affects children and young adults, as we discussed. Even the children have a seizure, but single seizure does not mean the person is epileptical, but single seizure can put the person in higher risk of developing epilepsy in future. Stroke. When we say stroke, always think about the head, not the heart. Another name for the stroke is cerebrovascular accident, CVA. As a personal support worker, when you are documenting the client, you have to write CVA. There is no place to write cerebrovascular accident. And remember, these bigger spelling are not used there anymore. You have to know it, but when writing, you have to write the abbreviation CVA. It is a disease that affects the arteries that supply the blood to the brain. When people say stroke, what you remember is the brain, it's the head, not the heart. Heart is different. We will discuss it later. Stroke occurs when the following happens. A blood vessel in the brain is blocked or bursts. See here, what happens in the stroke? A blood vessel in the brain is blocked or it's broken or burst, resulting in the blood supply to a part of the brain being obstructed. Means less and less or no blood goes to brain, people have a stroke. Simple, very simple. You don't have to get any confusion of the stroke. When the blood vessel that carries blood to the head, to the brain is impaired, it is blocked, partially blocked or completely blocked, or if it is burst or broken there, it means the person has a stroke. It's a life-threatening. And after the stroke, people have what condition? Paralysis. Do not forget it. A stroke is the fourth leading cause of death in Canada. That's the bad statement. See, a stroke is the fourth leading cause of death in Canada. It is a leading cause of disabilities in the older adult. The person needs emergency care. After the stroke, people should be sent to the hospital by calling 911. Do not take the person in your car to go to hospital emergency. Call 911 and send the person or take the person to the hospital. Sometimes a warning sign lasts a few minutes. Before person having the stroke, there is a warning sign. It is called transient ischemic attack. It's called TIA, transient ischemic attack, TIA. Means small attack. When it is a bigger attack, there will be stroke. When it's a small attack, it is called transient ischemic attack. Transient means very short period of time. Ischemic attack means because of the lack of blood circulation, this attack occurs. Some risk factor can be controlled, other cannot. What can be controlled? Lifestyle, dietary can be controlled, but if people inherit from their parents, it cannot be controlled. Age, greater than 65 years at increased risk. Gender, men are at a slightly higher risk than women. Who are higher risk? Which disease? Women, osteoporosis and osteoarthritis. But stroke, men are the winner. They get more chances of getting. Hypertension, another name for hypertension is high blood pressure. Smoking, it is very bad habit. Diabetes, this is the worst condition, chronic condition. High blood cholesterol, you have to go to the doctor and check the cholesterol level all the time. Lack of exercise, go to the gym and do workout at home, which is safer than going gym. High alcohol intake, alcohol can cause a stroke. High alcohol intake. See, these are the signs, these are the risk factor. So if we have to prevent ourselves, if we have to teach other people to prevent from this type of problem, we have to teach people that this is very bad to practice those habits. Continue of the stroke. Stroke can occur suddenly. The person may have the warning sign. These are the sign and symptom of a stroke. Number one sign says sudden weakness, numbness, and tingling of the face. The facial muscle becomes like, it's not your muscle, it's somebody's muscle. It's like a dead muscle. You cannot feel your face. Arm, leg, especially on the one side of the body. Another is sudden loss of speech. People cannot verbalize the word, and it has a trouble understanding what other people say. There is a cognitive level, cognitive function of the mind is impaired. Sudden vision problem, people see yellow color, sometimes the vision is impaired, especially in one eye. See, one eye. Sudden severe headache. Remember, every headache is not normal. Sometimes severe headache may be stroke with no known causes. Sudden dizziness, people feel fainted, and loss of balance, people fall on the floor. These are the sign and symptom of a stroke. Please read all these. These are very important for your exam. These are very important in your professional life, and these are the most important in your life. After the stroke, some brain damage is likely to occur. After the stroke, there is definitely the brain damage. Because of the brain damage, there is a stroke. That's why there is a brain damage is likely. Function is lost. The loss of function depends on the area of the brain damage. So if the bigger area damage, the more function lost. Rehabilitation starts at one. People have the paralysis at that condition sometime. Not sometime, most of the time people are paralyzed after the stroke, and the rehabilitation makes them normal. The healthcare team helps the person to regain the highest possible level of function. This is our duty. We are very near to these people having a stroke because we are there to give them personal care. We touch them all the time. That's why we are maybe very near working with these clients. Acquired brain injury. Acquired brain injury means what? Because of the motor vehicle accident, because of certain fall, we have this brain injury occurs, or our client have the brain injury occurs. Brain injury, it is a damage to the brain tissues caused by the disease, medical condition, or accident, or violence. People fight, they hit on the head. Most acquired brain injury are caused by the motor vehicle accident or car accident. It is called MVA, motor vehicle accident. Some are caused by the lack of oxygen. Some people who cannot have a good circulation in the mind, they don't have the good blood flow to the mind, and no blood flow means there is lack of oxygen and people have a brain injury. Sign and symptom depend on the severity, means the seriousness, and the location of the injury. What location, what part of the brain? Frontal lobe, occipital lobe, temporal lobe. There are 4 lobes in the brain. Which part of the brain? Another we are discussing is Parkinson's disease. Dr. Parkinson discovered this disease, and the disease is named after his name, Parkinson's disease. It's a Parkinson disease. Have you seen anybody having those Parkinson disease? People who are shaking the hand, this type of sign and symptom. A slow progressive disorder with no cure. No cure. The area of the brain that controls the muscle movement, the area of the brain that controls the muscle movement is totally affected by the Parkinson disease. Persons over age of 50 are always at higher risk. Sign and symptom include Parkinson disease, tremors. Tremors, another word for the tremors is shaking, hand shaking, as I told you. Shaking of the hand. The hand is not stabilized. Rigid, stiff muscle. Sometimes the muscle becomes stiff and rigid in the arm, leg, neck, and trunk. Trunk means abdomen, the body. Neck, you know what is neck. and legs and arms. All these part the muscles are stiff. Slow movement. People cannot have a good coordination in the movement. Slow movement. Stoop posture. People's backbone is a little bit stoop and the posture is there. You can see in the picture in the textbook, impaired balance. See, the balance is impaired. People cannot stand properly. Mask-like expression. People have a change in the expression. They feel like a mask. Mask-like expression. Other sign and symptom develop over the time when the disease becomes more severe and severe. Parkinson disease treatment, drug to treat and control the disease, it is only the symptom management, exercise and physiotherapy to improve strength. When these Parkinson disease are given good exercise for the posture, for the balance, and for the mobility. Physiotherapies are working with these people in the hospital and in the long-term care nursing homes. The client may need help with the activities of daily living. Activities of daily living means what? It is all about early in the morning, like personal care, peri care, mouth care, oral care, taking shower, eating food, preparing food, going groceries, and all other things that becomes the activities of daily living, doing some range of motion exercise, etc. Normal elimination is goal. Normal elimination means they leak the bowel and bladder. They use the diaper. We do not say diaper, we say briefs or pull-ups, and there is a elimination is goal. We have to teach, we have to schedule the toilet going habit for them. This is how the normal elimination means. The bowel movement and bladder movement are the normal elimination goal we have to set. Safety measures are needed to prevent the falls and injury. We always have to follow the safety measure. See the word safety first. Everywhere safety first. If people fall from the bed or bathroom, you are responsible for that. You will be charged for the negligence and neglect of the client's fall. That's why be careful. We always have to be careful. Now we are discussing about another disease. Its name is called Huntington's disease. Huntington's disease. Inherited neurological disorder. See, this is the neurons of the body, the head and the body, that destroys brain cells, that causes uncontrolled movement. When people have Huntington's disease, their movement, their balance is impaired, their movement is uncontrolled. Emotional disturbances. People have emotionally disturbed, means all the time they are in the mood, they are angry, they are mad at you sometime, and the cognitive loss. They cannot make a good decision. They cannot make a good judgment. Symptom begins between the age of 20 and 60. This is the age factor people are at risk of that getting. Begins with twitching of the muscle in the face. The muscle is twitching, feet getting, people are feet getting, clumsiness, very lazy and feeling sleepy, difficulty with eating and swallowing. People have a choking problem with this Huntington's disease because swallowing is impaired and activities of daily living is also impaired. No cure or treatment, but still they are giving medication for the symptom management. Thank you for your patience. This is the first part of this big lecture, big topic, and we will see you in the next topic. Thank you. Have a good day.